Hey, welcome back to the Intergenerational Trauma Therapist Show. And we are going to go over the last part of January and the beginning of February in our 2024 immersion calendar. And this calendar is for therapists who are working with intergenerational trauma and wanting to build kind of a foundation of knowledge and just a resource of kind of knowing what you're dealing with in order to know if you want to go ahead and get a specialty in treating intergenerational trauma or not. So today we're going to be talking about recognizing patterns, which is week 5 in January, and we will be talking about February is the pathway to specialization, and in this part of February, the first few days, we're going to be looking at assessing knowledge of how much you already know and where kind of those pockets of learning should be. So today we're going to look at patterns of behavior in families that are pretty much symptoms of intergenerational trauma and family dynamics that contribute to intergenerational trauma. So what are those things that you typically see in families that kind of support that perpetuation of that intergenerational trauma transmission? We're going to look at factors that contribute to positive outcomes. Then we're going to shift into assessing professional growth needs, finding experts to support your professional development, specialized consultation, and some learning milestones that people should try to reach. So we're going to start with recognizing patterns, and this is why these patterns are the exact reason that I created the 5 domains checklist for therapists. It has 5 areas where we'll typically see intergenerational trauma that if you're not specifically trained to assess it, this will help you kind of say, oh, this is what I'm seeing. It's also what I use to develop treatment plans from and kind of the starting of any kind of therapy when you know there's intergenerational trauma in the background. So the basic things that you'll see are attachment difficulties within the family system because intergenerational trauma impacts attachment, and particularly the hallmark that you're going to want to look for is if there's disorganized attachment anywhere in the family system, because this is really when you have a very solid case or a pretty impacted case from intergenerational trauma, you'll definitely see disorganized attachment, but not in every case. So if you see disorganized attachment, you certainly want to look if there's intergenerational trauma in the background. So on the parent side of the impacts or the patterns that you're going to want to look for is they'll have difficulties in parenting, and these difficulties will come from they have difficulties using parenting strategies that work, and they typically pick parenting strategies that backfire. And this isn't because they're not good parents. This is because they haven't had the exposure themselves to effective parenting strategies that they could then use with their own kids. You'll also see significant difficulties getting them to engage in therapy. They may drop a child off, not want to really stay, not want to be available to have any kind of consultation or coaching. They'll see this as the child's problem, and they'll be a little bit guarded with interacting with the therapist. They may get frustrated with the therapist because we're not trying to teach kids to get up, clean their room, get ready for school, go to bed on time, brush your teeth, all of those things. We just bring them in and we do intensive attachment-based work and therapy for them to heal so they can develop a kind of a quick, healthy relationship with us. And it can really kind of cause the parent to feel like we're undermining their parenting. So we have to really watch that. And you want to know if the parent has difficulties engaging in therapy, which then may cause therapy to end early. They may drop out, all those kinds of things. The parents also who are impacted by their own unresolved complex trauma typically have difficulty with co-regulation. They haven't had co-regulation with a caregiver in order to decrease their own dysregulation and then co-regulate in a parent-child relationship. So you'll see a lot of difficulties with co-regulation, and they'll also have a fairly negative mentalization of the child. And mentalization basically means, how do you understand the mind of another person or yourself? So negative mentalization, when you see this in therapy, you'll hear them say, he's doing this on purpose. He's trying to get under my skin. He's trying to drive me crazy. It's looking at the motivation and the purposeful behavior of the child, and it's a really negative interpretation. And this, again, is because their own dysregulation, there are difficulties co-regulating, that makes that kind of a perfect combination for that negative mentalization of the child. The patterns that you'll see in children and teens is the negative mentalization of themselves. So you'll hear or get themes of, I'm a bad person, I'm not lovable. You'll see all those negative self-beliefs that kind of go underground and operate unconsciously, but they really drive behavior. We'll also see those developmental impacts from intergenerational trauma or developmental trauma. So you'll see difficulties with attachment, biological development, behavioral difficulties, learning difficulties, and some disruptions in their relationships with peers and adults. So those are all things that you kind of want to have in the back of your mind to assess those patterns. Family dynamics that contribute to intergenerational trauma, they can be a little bit sneaky to detect if you don't have that specialized knowledge to know what you're looking at. But these are also what perpetuate that cycle in the transmission of intergenerational trauma. So one of the dynamics is if the parent experiences a lot of dissociation, so they kind of check out at times, they kind of either go what therapists call kind of dorsal, or they kind of shut down and they're really disconnected, because then the child isn't getting the boundaries, the care, the feedback that the child needs in order to feel secure. Also, any kind of neglect that's happening. So when we look at trauma, we always kind of think of events that happen, like abuse, natural disasters, accidents, things like that, that are like an event that happens that causes distress and later trauma. But neglect, the absence of things, so the absence of emotional resonance, the absence of a caring adult figure, absence of co-regulation, absence of food and safety, those are all properties of neglect that contribute to intergenerational trauma as well. The parents may unfortunately end up being in a position where they've had the failure to protect the child because of their own trauma. So if they have unresolved trauma and something is there's a threat that comes against one of their children or the family, if they shut down, they're not going to be able to really protect their child and give the child the sense of safety, which in more extreme circumstances can lead to that failure to protect. Another common dynamic that I see is grandparents raising their grandchildren, which is wonderful. There's nothing wrong with that. But when the parent is identified as the problem, and things like she's never coming back because she's no good, or he just never loved you, or things like that, you find sometimes people who are caring for somebody else's child, they'll say those things thinking it'll help the child kind of move forward and kind of work through it. But that does not work at all. If anything, it will create a split loyalty, which is, I can only have loyalty to this person and I can't have loyalty to this person. So if grandma or grandpa says that your mother is never coming back because she doesn't care, the child's going to be kind of driven to identify with and seek out the mother even more. So we have to watch for that dynamic and ensure that in some way, even if it's just memories and even if it's just honoring the position of the parent, we have to keep them involved because it'll create different patterns of intergenerational trauma, or it might be repeating one in the background of the family. So the other thing is sometimes families have secrets, and the secrets can sometimes put younger children at risk. So if there's family secrets and everybody knows that a certain relative has certain behaviors that are unhealthy for children or family members, but nobody says anything, any young person or vulnerable person in that family could be exposed to that. So that's another thing that you want to have kind of a listening ear for, is any kind of dynamics or secrets that are within the family. So one useful thing is to use, okay, my computer with my notes is frozen, so it just unfroze, so that's good. In the meantime, I'm going to say hi to Mohammed. Afghanistan is in the house. Great to see you, and thank you for attending again. So the main route of transmission of intergenerational trauma within a family system is that unresolved trauma in the parents or caregivers that exposes the child to developmental trauma. So that's the cycle that's between those two generations. And some of the concepts that you want to look at, we've already talked about split loyalty, which is a conflict between attachments that create considerable stress for all family members, but particularly for children. And in my training, the split loyalties, we look for these, and they can really pretty much predict mental health difficulties. So suicide attempts, depression, anxiety, and self-harm they can be rooted in this split loyalty in families because it's a stressful situation that children, they can't handle conflicting attachments. And then there's also invisible loyalties, which are repeated patterns from previous generations. So you might have somebody a few generations ago that had a lot of problems, went to jail or prison. Everybody else didn't go to prison. And then all of a sudden, a younger person kind of has that invisible loyalty and goes to prison. So this is another thing to look out in those patterns in families to kind of detect some of the things that may not be healed or resolved or integrated into the family, and then they create difficulties later on. So now we're going to look at positive outcomes. So what is it that we want to see when we're working with intergenerational trauma? And basically with the intergenerational resilience method, there's 4 main parts of it that can shift the transmission of intergenerational trauma into intergenerational resilience. So the first stage is to improve regulation. It's really, we start with the parent. So we do parent coaching. We help the parent learn to regulate self-regulation through the co-regulation with the therapist. And then we use that experience and those skills to help co-regulate their children. So we want to improve regulation. And when there's greater regulation, we can then work on enhancing earned secure attachment. So then we address the attachment difficulties in the family. We also want to address the developmental and trauma impacts on the children and teens as well, so that the difficulties that they're having are either cleared away or integrated so that they're not problematic in the here and now. And then the last thing is we want to build connection between family members, between generations, and build that family resilience. So we want to look back through the family history and look for moments of resilience that previous generations had shown, and seeing how we can harness that in the current generation or where it shows up in the current generation. So in the intergenerational trauma program, there's 3 phases. The first phase is to calm the family nervous system. So that is both working on developing regulation, self-regulation and co-regulation, and addressing attachment behavior. So we really want to get in there and help stabilize the family relatively quickly, because these are families that have been generations deep sometimes of living with chaos that they either think is normal or they think there's no hope. So we have to be able to help them have a different experience, show them a different way, and do it in a way that quickly builds hope so that they have the motivation to continue. So after we calm that family nervous system, then we specifically address the parent's unresolved trauma. And then we address the child and teens trauma, and we build that family resilience kind of in a parallel way as the child's going through therapy. So that is the end of January's content. And now we're going to move into February's. And February is based on the pathway to specialization and how do you know what skills you need to develop? What areas of expertise do you need? How do you find mentors? All that kind of good stuff. So the first thing we're going to talk about is assessing the therapist's growth needs. Like, where are the pockets that you need to learn in order to have a concrete model to work with intergenerational trauma? We have an obligation and an ethical obligation to maintain competency in the areas that we're working with. So if you start to have a lot more people impacted or identify a lot more people impacted by intergenerational trauma, we have an ethical obligation to be able to have the skills to work with them, or we need to transfer them to somebody who can. So it's really important for us to develop these skills. And it's often overlooked when we're looking at self-assessment of competency, because the main way intergenerational trauma is approached is adult trauma is kind of siloed, and then childhood trauma and teen trauma kind of siloed, and then maybe family therapy kind of siloed, and maybe some attachment, but it's not a kind of web or system or framework to hit all these very effectively and efficiently. So this area is often overlooked when we kind of look at what skills we need to develop. The difficulty with this, if we don't develop these skills, these are highly complicated and very vulnerable families. Now, I don't mean vulnerable in that they're not tough. These are some of the most resilient, tough families I've ever seen that I've worked with. But they're also vulnerable to re-traumatization or feeling hopeless or not liking therapy. So there is a vulnerability there because of the heavy impacts of intergenerational trauma. And there's very few comprehensive programs that develop this as a specialty. There's bits and pieces in those different trainings. So maybe attachment, EMDR, brain spotting, play therapy, but they're not woven together in an efficient and effective framework. So when we look at assessing our knowledge, there really isn't an assessment or a checklist to learn where the pockets are that you need to kind of work on, or where you should hone your skills. It takes so many complex areas. Like, complex trauma is complex to treat, and that's just one area of this. Developmental trauma can be very complex because of all those impacts in those various domains. That can be complex. Attachment can be complex. Family therapy can be complex. So we've got all these major complex components that are present with intergenerational trauma that we have to know what areas we need to specialize in. So any one of those areas is very complex to specialize in. So I've developed an interview to assess a therapist's knowledge and skills for treating intergenerational trauma, identifying how to build a pathway to specialization. It's also available for agencies like child welfare agencies that want to have a system or a framework for working with families that are impacted by intergenerational trauma, or private practice owners who want to develop this as a specialty area for their staff. So if you're interested in that, just message me and I can give you some details on that. But it's very difficult to address all these areas. We need advanced knowledge, that specialization, consultation, ethics, and cultural competency. We need to really take care of ourselves and build our own resilience. We have to have treatment planning that includes multiple people in the family system and outcome measures. So that is a heavy, heavy load to try to figure out. So I would encourage anybody to explore those areas of like where your competencies are, specialization and advanced knowledge, consultation, ethics and cultural competency, all those areas. If you do just kind of a quick self-analysis, you'll probably find some areas that you need to get some support in. So where do you find these experts that have treated this and have it in a way that they can train other people? So it's so important to learn from these experts because we can rely on their experience and knowledge to advance the learning process more quickly and have fewer setbacks. So the more we work with specialized supervisors or consultations and other people, like in a group consultation, will learn quicker and we'll learn the landmines that we don't want to step in therapy, and we'll learn things that really worked and strategies that were really helpful. Again, my path to specialization, it took 15 years of learning all these different components, getting specialized training, getting supervision and consultation, but the path doesn't have to be that long. It's because I didn't have a framework or a specific mentor that was dealing with this as a specialty area. And we do need specialized consultation because if you get within a consult group that isn't aware of all these impacts and the complexity of intergenerational trauma, there's so many moving pieces in therapy that we have to be able to identify and work with. So it's useful to have an outside perspective and to help us maintain our focus on where we need to kind of address things in the family. Consultation also improves therapist resilience, especially if you're working in private practice. Because in private practice or in therapy, it's just us, the therapist, usually, unless we're doing co-therapy, it's usually just us and the family or the clients, and it's pretty isolating. And if you're in private practice, especially if you're a solo practitioner, it can be even more isolating because we can't talk to anybody about what we're dealing with except for in confidential formal consultations. So that can become very difficult for people to maintain their own resilience and avoid burnout. And when we're in consultation or consultation groups, it advances our knowledge relatively quickly, it builds our self-confidence and self-efficacy as well. So finding the right consultant can be kind of difficult. You may need to do some trial consultations, make sure it's a good fit, make sure they have the knowledge areas if they're not working from a particular framework. So you want somebody with specialized knowledge, training, and experience. Group consultation also has amazing support because you get so much input, and people like see things differently, or they'll notice a dynamic in the presentation of a case and they'll ask that, and it just kind of is a key that unlocks a whole new level. So when all of us not all of us, but when a small group of us come together and share those insights, ask those questions, it can really propel us to a much greater level of efficiency and effectiveness. So places you can look are professional associations or networks. You can ask colleagues or peers. There's specialized programs typically include consultation groups. You can look at authors, workshops. And again, that trial consultation is important to determine if it's a good fit. So, what are the learning milestones that therapists need to reach in order to develop this specialty? So, the milestones are they're not typically related to a specific intervention, but they're skills related to specific presentations. So we have to have the ability to intervene with families to decrease that dysregulation in a way that supports attachment and the caregiver's unresolved trauma. So that's where we really want to get in and get to that as quickly as we can, because that's the main mode of transmission that we can have an impact on. We want to increase the safety in the parent-child relationship and build that attachment. We need the skills to treat complex trauma in adults. We need the skills to treat children and teens. We need to be able to build connection between family members in pretty complicated situations where there can be a lot of pain between family members and generations when you're dealing with intergenerational trauma. And we really want to tap into that family resilience and build that intergenerational resilience. So some key examples of milestones. We froze up again. There we go. Again, remember, my milestones took 15 years. Yours don't have to take that long. With the intergenerational trauma program, it's a minimum of 6 months of course instruction. There's 2 months on each module. So there's 2 months on kind of the parent coaching to calm the family nervous system. Then it's 2 months on complex trauma in adults, and then 2 months on the trauma in children and teens and building that family resilience. And then there's case consultation and presentation of cases to get certified. So that is really, if you started and really implemented it as you went, it could be about 6 months for you to get that specialization where you could confidently and competently work with intergenerational trauma. So I would ask you to just do that self-assessment and look at what key areas you may need to focus on. What milestones have you already reached, and what milestones do you need to reach? And look forward to developing those skills. So I'm looking forward to February because it's all about specialization. And I really love this area because it's so important for us to provide what our clients need through that specialization. So next week, we're going to be talking about developing an expertise in intergenerational trauma therapy. So you won't want to miss out. If you don't have a copy of the calendar, go to calendar.barbarawoodsphd.com, and I'll put that link around this video so that you'll be able to access that easily. So that's all it is for today, and I hope you have a wonderful day.